All right, in all of that, something struck me in the Prime Minister's press conference. It was comments from the Chief Medical Officer, Brendan Murphy, about what's concerning him.
We are very worried about the rate of rise in the number of cases of coronavirus in Australia, particularly over the last few days. It is a very, very steep growth and it's very concerning.
I'm joined now by Professor Michael Kidd, Principal Medical Advisor to the Department of Health from Parliament House in Canberra. Professor, thank you very much for your time. I want to just start, if we can. You know, I spent many years watching politicians deliver speeches and I certainly paid attention to the PM, but I was really struck by the level of concern we saw from the Chief Medical Officer last night. Are we beating this? Are we where we want to be, or are we really, be honest, are we running behind?
Well, thank you, Peter. Obviously, this is something where everyone in Australia has a role to play in stopping the spread of the coronavirus. And the advice that's come forward from the Chief Medical Officer is based on the best evidence that we have, looking both overseas, looking at the experience of past pandemics and advice about where people think things are going. What we do know is that the epidemic in Australia has changed over recent days and has changed from the majority of cases of COVID-19 being people who had come into the country from other places, moving towards the majority of cases now being people who have been infected within the Australian community. And that's why we've seen this very dramatic increase in the restrictions which have been imposed on the community. But also, Peter, I think it's really important that everybody out there listens to the messages, but everybody also does three very important things. The first thing is being incredibly scrupulous about our hand hygiene, making sure that we're washing our hands appropriately or sanitising our hands, not touching our faces, and doing this each time that we've touched anything else or been in contact with other people. The second thing which everybody needs to be doing is, of course, maintaining the physical distance between people. It's been remarkable watching over the last few days how Australians are really picking this up. When people are standing in queues, they're very conscious of 1.5 metres in front, 1.5 metres behind. And the third thing, of course, is that if people develop symptoms, fever or respiratory symptoms, that they stay at home and they seek advice, either through contacting your local general practitioner or other healthcare provider, or ringing the Health Direct line or the lines in each of the state for advice about what to do. And most importantly, Peter, if people are either being investigated to see if they have the coronavirus, or if people have been diagnosed with COVID-19 and are told that you have to stay at home, that is what people do. As soon as you get your diagnosis, you go straight home and you don't go anywhere else, and you stay home until you're cleared. And if we do this, and if all of the community adopts these measures, we have a great opportunity to flatten the curve, to reduce the transmission, most importantly to protect the most vulnerable members of our community, and to prevent the surge that we've seen on hospitals and intensive care units that we've seen in some other countries.
Yeah, and I might add, you know, staying at home doesn't mean dropping around to see Nana on Sunday because she hasn't had visitors for a whole week because she's in self-isolation, or leaving food and taking it upstairs, let's say, at the house and putting it in the fridge, or going around there and doing her laundry, making the bed and, you know, running around with a vacuum cleaner. All of that is contact with a vulnerable person. When we say self-isolate, stay home to protect older people, it really is a fact that no one should be crossing the threshold of these homes. If anything, it needs to be given to people who are vulnerable, and we're talking people sort of 50, 60, 70, 80 vulnerable. We're not talking about people just in nursing homes, are we, Professor? All that stuff's left at the front door, and this is so serious now. I've got a graph there I'll put up there just to amplify to people how sharply those increases have been across our states and territories. This shows you we are really at a very critical period from now. We're at 2,000, and if we double as quickly as we've moved elsewhere up that curve, it suddenly 2 becomes 4 and 4 becomes 8 and 8 becomes 16, and then we're away. Then we're really in some terrible situations. Give me a sense of the workforce scale up too, because I'm aware that we're calling back nurses and retired doctors and all the staff we possibly can.
If I can just comment on a couple of things that you've said first, Peter, the graphs that we'll watch, we expect numbers will continue to rise because, of course, the infections that we see are people, the new infections that are being diagnosed are people who are infected a number of days ago. So the measures which are in place now, we'll expect to see the impact of that occurring in a week or 2 weeks or more from now. The other issue about vulnerable people, thank you for the things that you're saying about protecting especially our elderly members. It's very important that we maintain that physical distancing from people who are vulnerable. And it's not just elderly people in their 70s, 80s, 90s. It's Indigenous people who are 50 and over. It's people with chronic conditions, which if they developed COVID-19 could put them at very serious risk of deteriorating. It's mothers or parents of children under the age of 1. It's women who are pregnant. It's people who are immune compromised. It's many, many people in our society. And so those measures need to be in place. The issue about the workforce, one of the things that I've been really heartened by, Peter, is seeing how many people are putting up their hand saying, how can I help? Doctors, nurses, students from our universities and our colleges, allied health professionals, many people who have recently or are retired or have been retired from the workforce for a number of years are putting up their hand to say, how can I help? There's two issues here. One is that some of these people themselves, if they're elderly or have chronic disease, may be vulnerable people. So the sort of, as people come into the workforce, we need to make sure that they are placed in situations where they themselves are not at risk of becoming infected. But also there is the need for surge capacity in a number of areas. The government has announced funding to support the retraining of many nurses who have been out of the workforce for a number of years to train people up. We have online training that's now available to support people, and particularly we're wanting to train up nurses in case we need to open more intensive care beds, in case we need to have more people on ventilators, to make sure that we have additional staff to support those measures, and also to make sure that we can provide some relief to our healthcare workforce so that people are not working 24 hours a day, 7 days a week, as we saw in Wuhan and as we've seen in Italy over the last week or so.
Professor Michael Kidd, thank you very much for your time, and good luck for the weeks and months ahead.
Thank you so much, but we're all in this together. Thank you.